The information presented in this presentation is not a substitute for examination, diagnosis, and medical care provided by a licensed and qualified health professional. The opinions expressed by this speaker do not represent those of Advent Health. Please consult your physician before undertaking any form of medical treatment and/or adopting any exercise program or dietary guidelines. If you think you may have a medical emergency, call your physician or 911 immediately. Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Okay, hi everyone. I am Dr. Zhao. I'm a primary care physician with Advent Health in Ocala. I am trained in internal medicine, and today we're going to talk about wellness visits. We can get started. All right, so very commonly you might have heard the terms annual wellness visit and also Medicare annual wellness visit. They're actually very similar, and today we're going to focus on the Medicare annual wellness visit because it is more comprehensive and much more applicable to today's audience. So usually if you're over 65 and have Medicare insurance, the type of wellness visit that we do is the Medicare annual wellness visit. And if you're less than 65, usually it's just called an annual wellness visit. Just to clarify on those terms. So what is a Medicare annual wellness visit? I made this presentation in question and answer format, and we're going to answer those questions. They're commonly asked by my patients, and maybe they are your question too. So what is the reason for the visit? Who qualifies for this visit? How long does it take? Can I discuss my regular medical concern during the visit? How do I prepare for it? How is it similar to my routine visit and how is it different? What are the screenings for women and what are the screening for men? Any special testing for smokers, immunizations, and other screenings? So the first question is, what is the reason for this visit? The main reason is for prevention or preventative care. And the big prevention we do is cancer screening. So there are different tests that are recommended for cancer screening depending on your age and risk factors. We also do depression screening because mental health is as important as your physical health. We also do cognitive function screening. Memory issues is very common. It's a very common concern from the patients and also their family members. It's very important to identify and treat as early as possible. And also many things can get missed during a routine visit. So during this wellness visit, we have a very good opportunity to get everything caught up. So who qualifies for this visit? This is very easy. I mentioned earlier, anyone who has Medicare insurance, and this visit should be at no cost to you. How long does it take? Usually this is a long appointment. I say prepare for 45 minutes to even 1 hour, depending on your history. So usually the nurse will start with different screening tests, and then the physician will take over to discuss the result and make recommendations. Can I discuss my regular medical issues during the visit? So as I mentioned earlier, this appointment can be very long. So if you have anything that needs to be addressed, you should give the physician a heads up before the appointment. And how do I prepare for this visit? So just like your regular visits, you should know your health history, know your vaccination records, and always bring your updated medication list or just bring your medications to the doctor. So this includes over-the-counter medication and also any supplements that you might be taking. If you're having any memory issues, it's best to bring a family member, and this should be arranged ahead of time. Next question is, how is it similar to my routine visit? So just like any other routine visits, we will review your medications, update on all your vaccinations, check your height, your weight, blood pressure, measurements, and calculate your BMI, which is your body mass index. And this can be calculated by your weight in kilogram divided by your height in meters squared. So that we are halfway done. That was 6 questions out of 12 questions. So here comes to the important question, how is it different from my routine visit? So during a Medicare Wellness exam, you will have a simple vision test, and there will be many more screening tests. For example, depression screening, usually this is a questionnaire on the paper. The nurse or doctor will ask you questions and you just answer the questions. And there will be a cognitive impairment screening, and this can come in many different formats, but usually it has questions, word recall. For example, we tell you 3 different names, and we ask you to tell us the names later. Simple math questions and simple drawing task. For example, drawing a clock or different shapes. Cancer screening checklist. This one I will go into detail later. And immunization checklist, which we'll talk more later. And also, it is also a good opportunity to talk about advance directive if you don't have one. So what is a advance directive? This is assigning a power of attorney, which means someone you can trust to make decisions for you if you're unable to. And the living will. This one means if you're critically ill, how aggressively do you want the treatment to be? So specifically, what are the screenings that we do for women? The first one is cervical cancer screening. Usually, we're talking about the Pap smear, which stops at age 65 if your last Pap smear was normal. If you're unsure about your gynecological history, you can ask your gynecologist or your PCP. And the other important one is breast cancer screening. This one we start at age 40. We recommend mammogram every year or more frequently depending on your personal history and family history. Usually we stop the screening at age 75. However, this really depends on your history and how healthy you are. For my patients, if I expect at least 10 years of life expectancy, then I continue screening even after age 75. Another one is osteoporosis screening. So this is recommended for any woman age 65 or up, and we repeat it every 2 to 3 years, depending on results. So now screening for men. Prostate cancer screening is a very big one. I get a lot of questions from my patients. So the test that we do is called a PSA, which stands for prostate specific antigen. If this number is less than 4, it's normal. If it's higher than 4, then we have to do more investigations. Sometimes a lot of factors can affect the PSA level. for example, prostate infection, UTI, or even if you had a long bike ride, can raise the PSA sometimes. And usually we stop the screening at age 70. A lot of patients ask about a digital exam. So actually since 2018, this is no longer the recommended testing for prostate cancer screening due to the lack of benefit and evidence. And cancer screening for all is colon cancer screening. So colonoscopy is the best test, and we start recommending the test at age 50. A lot of patients don't like to do it. You know, they always ask for alternatives. So other options are available. For example, stool test. You might have heard of Cologuard, which is a very good DNA test, and it's a stool test. But the best test is always colonoscopy. How often to repeat it? Every 3 years, 5 years, 7 years, or 10 years, depending on what they find, depending on your personal history and family history. And we usually stop the testing at age 75. So any special testing for smokers? The first one is called the AAA test, which stands for abdominal aortic aneurysm. And this is a very simple and non-invasive test. It's basically an ultrasound checking your abdominal aorta. So this is for anyone with any smoking history, and we start at age 65. And the second screening is called the lung cancer screening. This is a low dosage CT screening. This is for any current smoker or former smoker if you quit within the last 15 years. We only recommend this if you had a very long smoking history. For anyone who smoked for 30 pack year or higher, and we start the screening at age 55. A lot of people ask, what does 30 pack year mean? So here is a little example of the calculation. So it basically means the number of pack per day you smoked times the number of years you smoked. So if you smoked 1 pack per day for 30 years, then you will have 1 times 30, then that's a 30 pack year history. If you smoke 2 packs per day for 15 years, that also equals a 30 pack year history. All right, so some patient might ask, why do we have to do a CT scan? Is the chest X-ray good enough? So a low dosage CT scan offers much more information than a plain chest X-ray. And at the same time, you have much less radiation exposure compared to a regular CT. So this is a very good test. And this is recommended for anyone with a 30 pack year history, and we start at age 55. The next big component that we do during this visit is vaccinations, and we have a lot of questions on vaccinations. So if you're age 65 and up, the following are the vaccinations that we recommend. The number one is the flu shot or the influenza vaccination. This one we recommend every year. They have the regular dosage and also the high dosage. We recommend the high dosage for people 65 years and older. The next vaccination is the pneumococcal vaccines. And there are 2 shots. The first one is called the Prevnar 13. The second one is called the Pneumovax 23. The numbers stands for the number of strains of the bacteria this vaccination covers. So the first one covers 13 strains of the pneumococcal bacteria, and the second one covers 23. And a lot of people ask, do you need this just one time or multiple times? For most people, you just need to get the 2 shots one time and then you're done. But however, if you have COPD or are very high risk of getting infection, we recommend repeating the 2 shots every 5 years. The next vaccination is the shingle vaccine. So I get a lot of questions from my patient. There are a lot of confusion about this vaccine. So the current recommendation is if you're 50 years or older, we recommend the Shingrix vaccine. This is the new shingle vaccine. It's much more effective than the older one, which was called the Zostavax. This one is 95% effective versus the older one was only 55% effective. And the Shingrix is a 2-shot series, but you usually get it at least 1 month apart. The next vaccine is the tetanus shot or the Tdap. We recommend this every 10 years. The other screenings that we do in our office are alcohol screening. This is just a very simple question. How often do you drink? Do you drink by yourself? What kind of liquor do you drink? And the other one is fall screening. Usually for older patients, it's important to see how they're doing with their gait and balance and to assess the risk of falling in turn to prevent fracture. Okay, so that's all we have for today. Usually when I do a live lecture, I get a lot of questions on vaccinations. I actually have a lecture entirely dedicated to vaccination. So if we have more questions on that, I'm more than happy to provide that PowerPoint. And the following information, you can see I go to 2 locations. One of them is near the hospital in Ocala, and the other one is in Marion Oaks. I go there every other Thursday. I hope this was helpful. If you have any questions on the PowerPoint regarding the wellness visit or the vaccination, feel free to contact me. I'll be happy to answer and help you out. All right, you guys take care and stay safe.